Hello everyone, welcome back to 48 Now. I'm your digital host, Tatiana White, and today I'm joined by Flourish Behavioral Health and On My Way Home Family Enrichment Services Executive Director, Paula Erskine, and Assistant Director, Anisa Cannon. How are you both doing today?
We're doing great,
Yes, I'm doing great. Thank you both for joining me. I'm very excited to hear all about the wonderful things your organization does.
Well, thank you for having us.
Thank you. And so family healing and safe spaces, that's the foundation behind Flourish Behavioral Health and On My Way Home Family Enrichment Services. And so today we're joined by Paula and Anisa to learn more about their work, their mission, and their team is providing critical resources to families across North Alabama. And so can you guys just tell me a little bit about yourselves, how you guys kind of got started with this organization?
Okay, so I met Anisa about 4 years ago. We was actually doing some things with DHR, and that's how we met. And then after that, we just remained friends over the years. And I had asked Anisa would she join me on the projects that I have with On My Way Home Family Enrichment Services, as well as Flourish Behavioral Health, and she said, sure, I would love to join you.
I love it. And
Yeah.
so how did you feel when you joined the team and was a part of it?
I mean, I really liked it. I appreciated the assistance that she provided for me, and so I really wanted to be able to be that resource for the community, families.
Yes, awesome. And what makes like your services unique kind of compared to other like health, mental health kind of services?
Okay, so what makes ours unique, I think, would come to with the behavioral health part. We actually cater to the veterans, children with special needs, adults with special needs, and also women and children. That's what kind of like that's displaced and that's living like women's and children's shelters, and we can provide our services like going out to where they at, especially if they don't have the transportation. So,
Awesome.
yeah.
And what like made you want to create this organization?
Okay, so actually I wanted to create it because I had entered into a contract with DHR, and I was like, okay, so should I do adult protective services or children protective services? And then over the years, I got familiar with both adult and children, and I was like, okay, so I like both of them, so I'm going to branch out to both and just not just one.
Yes, and that's awesome that you do adults as well. I know a lot of the
Yes.
time it's like something just for children, so it's good that you have something for all age ranges and like veterans and you know
Yes.
all types of different people. So that's awesome. And so you offer like a broad range of services,
Yes.
like from supervised visits to
Yes.
mental health coordination and stuff. So can you give like an overview of like the types of families and clients that you support and how do you kind of help them through those services?
Okay, so which sector on the business?
Yes.
Okay, so Anisha, would you like to address that?
Sure. So the families that we serve for supervised visits have gone through something with the courts that require our services. To cater to them, we analyze each family individually. So what works for family A may not always work for family B. So it's really catered to their individual needs.
Awesome. And for the behavioral mental health specialists, do you guys just pick, do people come to you guys or do you guys, how do you guys do that?
Okay, yes. So actually, they can be referred to our program through a social worker, a pastor of a church, or perhaps even a doctor, physician. So that's how we pretty much get our referrals.
Awesome. And how do you ensure like that safety and emotional well-being during those like supervised and therapeutic family visits?
So if the visit's taking place at their home, a home assessment must take place prior to the visit. If it's in the community, we want to make sure that the parent is aware of their surroundings. We have to be aware of the surroundings. Although it is the parent's responsibility to maintain the safety of the children if we're in public, our staff, including Ms. Paula and myself, we're always, heads on a swivel, right?
Yes.
Trying to make sure that we don't encounter an issue. If we do, we've all been trained on what to do in adverse situations.
Yes, and I love that you guys go to their homes too, so
Yes.
they're in their own like safe space. So,
Yes.
And so you guys serve multiple counties across the Tennessee Valley, and so how do you guys just manage like such a big range of counties? And do people travel to you, or do you guys just travel to them?
Okay, so it could be either way. So actually, we do cover Madison, Limestone, Morgan, Marshall, and Jefferson County. So what we do, Anisha and I, we try to network and find individuals in that area that's have the qualifications that we need and that we're looking for to cover those counties.
Yes, and do you guys work with schools or like any type of organizations, or is it kind of independent, family based?
Okay, so right now we are in the process of working with the early intervention.
Okay.
Okay, so we pretty much can't wait to get that contract sealed. And also we work with, again, DHR, Department of Human Resources in the state of Alabama for those counties.
Yes. And can you talk a little bit about like the expertise that your team kind of brings to the table to ensure these services are best for the families?
Well, so each staff member is vetted properly, so proper application, background, their education and employment histories are evaluated. We look at anyone that has the credentialing already or currently pursuing any credentialing that we may need in order to fulfill our obligations to our vendors. And then we also do, in-home on-site trainings within our company to ensure that everyone is thoroughly prepared.
Yes, I love that, working together to make sure you guys are on the same mission and page. So yes. And I saw that you guys also provide like IEP assessments and 504 plans. And so for families watching who may not understand or know what those things are, can you kind of explain the advocacy behind that?
Yes, so what we do with that, so actually you do know that with those assessments that the children have to have some type of special, like they're in a special program, education program. And so if a parent seek out to us, we consult them and to let them know this is the application you need to fill out. So in other words, we pretty much kind of like proofread their the application or guide them on how to even start the IEP or whatever is requested from the school. So we pretty much help them in those areas. So because again, a lot of our parents don't know how to start to get it started.
Yeah, that's really good. My mom is a teacher, and so she also says that a lot of like parents don't really know how to kind of get that started. So that's good that there's a service there that helps them with that. So
I have firsthand knowledge on how to do that. My background's in biology and education,
awesome.
and then one of my children has an IEP, so I can give them firsthand knowledge on it.
Yeah, that's really good, and I bet that's helpful and comforting to them too, knowing that like you have firsthand knowledge yourself.
Yes.
So yes. And why do you both believe like early intervention is such a key part of your work, and what difference does that early intervention make in a child's life?
Okay, so I think actually for one, for us to offer those services, so say for instance if a child have a meltdown and the parents might not know how to handle that situation, so that's where I consider our team as trained professionals to go in and guide them and comfort them and get them back to a level where they're not as stressed or stressed or anxious, yes. And so to comfort them, to let them know that it will be okay during this time.
But yeah, that's good. And like, so you feel like this is important to build a child's life, like just helping them with that early intervention by helping them understand their emotions at a young age.
Yes.
The earlier you catch something, the better it is long term, because the child can grow with coping mechanisms.
Yes.
Especially for those who are, for instance, autistic. Sometimes they will have a meltdown without true provocation that we would think would provoke it, but anything can trigger that meltdown. And so just teaching them coping mechanisms, so when they see something or something happens that triggers a reaction, they can actually appropriately deal with it, as opposed to using mom or dad or guardian as a crutch.
Yes, that's awesome. Yes. And so is that something you guys help with those IEP plans, like those coping mechanisms, and putting that there so teachers and stuff understand, like if they're going through something?
Yes, and even during a visit as well. So sometimes you'll see mom or dad about to have a meltdown themselves because they're not accustomed to dealing with something like that on a daily basis. So then it's like, hey, so this is what you need to do. Now go try it.
Yes.
Type deal. And then just each visit, you're just building on those techniques and tools.
Yes, awesome. awesome. I love that. It's like you guys are including every important person in their life, from their parents to their teachers, and then you guys come in. So
It
that's
takes a
awesome.
village.
Yes,
Yes.
it does. And so you guys said you have experience working with veterans, special needs children, and families in crisis. And so how have like your personal and professional experiences prepared you to work with all these different people?
Okay, so with me, I have a cousin that's special needs, so that's mainly also one of the main reasons that I decided to go into this area of the services that we offer. And two, I have several family members that are vets and also having some crisis, like trauma, and so I try to like reach out to them on a professional level and seek and get them help as well. So that's the reason why I focus on those, especially those two.
Yes, that's awesome. And what about you?
I have family that's special needs. I have my favorite cousin. She's in a wheelchair, and so usually with those clients that we get, I flock to them because I'm so used to dealing with it, or being around it rather. I've helped kids, with basic living skills. So learning how to cook for themselves, change themselves, get themselves in and out of the shower. Again, my education is geared towards around that background as well. So
yes, I love it, and I feel like that's also a way to comfort them too. You guys have that experience, and so it's not like you guys are going into it blind. You guys know. So. And so, Anisa, what brought you into like this work, and what makes you passionate about helping these families thrive, and what made you want to connect with Miss Paula?
I'm a people person, and I love doing acts of service. So this is a major act of service that we're doing for the community. We have history because of a situation that brought me to her, and praise God, it worked out. My situation and me being able to help, like I said, with her helping me and my family, I wanted to provide that same service, and I knew that I could assist her in doing that.
Yes, I love that. And if a parent, guardian, or a caseworker is watching and needs help, how can they get in touch with you all, connect with your resources? How can they go about making referrals and all of that?
Okay, so first of all, they can reach out to us on our platform, which is Instagram, LinkedIn, and also Facebook. And we have a phone number and contact number on there, so they can reach either me or Anisha if they need assistance.
Yes, awesome. And are you guys currently looking for volunteers, community partners, or any support that the public can give your organization in any way?
Yes, we are. So we're looking for volunteers and also partner organizations as well that aligns with our mission.
Yes, okay. And can they just reach out to you guys?
Yes.
And okay, perfect. And what's your both of your biggest hope for the future for the organization? Any upcoming goals, events, or anything?
Yes. Should I answer that?
Sure. So we want to grow. That is the biggest thing, so that we can actually, reach more people in the community. We're thinking about having a back to school drive next year. I know it's only like a month away being here, so it's kind of short notice as far as planning, but we're wanting to gain more vendors. So yeah, just growing and being able to provide, and people want to donate or volunteer or actually just work for us, that would be perfect.
Yes, and I'm sure they will. What you guys are doing for the community is so amazing.
Thank you.
Just being able to connect with those families that sometimes may be overlooked. So
Right.
yes. And is there anything else you guys would like to share? Anything we haven't touched on?
Okay, so we have several upcoming projects, which is we're very excited about. But again, I guess if we meet you again and we'll discuss that, I don't want to just put it out there too soon. But we're really excited about this 2 upcoming projects in the,
Awesome, yes.
in the future.
I would love to have you guys back to talk about it. Well, thank you both so much for sharing, and I really loved hearing everything you guys do, and I can't wait to see you guys continue to flourish.
Well, thank you.
Yes, thank you. And thank you all for tuning into 48 Now. To learn more about Flourish Behavioral Health and On My Way Home Family Enrichment Services. You can visit their website or social media pages, which will also be linked in the web story. Their work is making a real difference for families and children in North Alabama, and if you or someone you know could benefit from their services, don't hesitate to reach out to them. I hope you all have a great rest of your day.